Now here's a step-by-step guide in how to perform a divide and conquer for beginner surgeons embarking on their journey of learning phaco emulsification. Prior to embarking on learning this surgical technique, it's very important that the surgeons should have a good hand-eye coordination and should be well versed with the microscope, its settings, as well as understand the settings on the phaco machine that they're going to operate with. The correct case selection is extremely important. A pre-op evaluation of the patient by the surgeon himself is very essential. The grade of the cataract should be like a grade 2 or 3 nuclear sclerosis and should not have any associated ocular comorbidity. With all of this in place, let's get started with learning the technique. This is a patient with a grade 2 nuclear sclerosis in a well-dilated pupil. We start with creating the main incision. I stabilize the eye with a cotton bud. Ideally, you can also use a limbs forceps to stabilize the eye, after which the incision is made in the clear cornea. One enters into the cornea up to about 2 millimeters, after which you pierce the desmoids and enter parallel to the iris so as the widest part of the blade enters into the anterior chamber. Note how the incision is made perpendicular to the tangent at the point of entry. You will also notice that the incision is completely within the clear cornea. A 15-degree blade is used to create the second paracentesis incision. This incision is made 3 clock hours apart in clear cornea and angled towards the center of the anterior capsule. The main incision and the paracentesis incision make an angle of approximately 90 with each other. This angle between the main and the paracentesis incision is extremely important for allowing comfortable maneuverability of the instruments intraoperatively. I then create the second paracentesis incision, which is slightly wider because it's used later on for the irrigation aspiration. The next step is staining the anterior capsule with blue dye. A few seconds after introducing blue dye into the anterior chamber, it is then washed out. It's important to not try and wash out the air bubble at the same time. Having washed out the blue dye, some viscoelastic is introduced into the anterior chamber, first insufflating the lower half of the anterior chamber and then filling the upper half of the anterior chamber on its way out. Having flattened the anterior capsule, we now proceed with the Capsulorhexis. An initial nick is made, after which a flap is raised, and then this flap is drawn with the help of the capsulotome, and then this flap is navigated to create the Capsulorhexis. The aim should be to create a 5.5 millimeters well-centered circular Capsulorhexis. The Capsulorhexis can be created, as you can see in my case, through the main incision or through the paracentesis incision, but it is important not to press at the limbus while doing so, because that could result in shallowing of the anterior chamber, which may make the completion of the rhexis challenging. Next, we proceed with the hydrodissection. Some viscoelastic is first removed from the anterior chamber, after which the hydrodissection cannula is introduced deep to the Capsulorhexis edge and some fluid is injected. This is done on both sides. Now, how you do know that the wave has gone behind the nucleus is when you find a nucleus rise. Having completed the hydrodissection, under viscoelastic cover and after stabilizing the globe, notice how I use a Sinskey hook held in the mid-periphery of the nucleus to confirm the nucleus rotation. We are now ready to perform the nucleus management. The phaco tip needs to be visualized to ensure that you've got an adequate exposure of the phaco tip. After stabilizing the eye with the limbs forceps, with the irrigation on and a bevel down position, the phaco probe is introduced into the eye, after which the tip is turned upwards. The second instrument is then introduced into the eye, and all the excessive cortex overlying the nucleus needs to be first aspirated. Having done so, we are now ready to start the nucleus management. Prior to sculpting, it's important to ascertain what would be the center of the nucleus, which largely is the center of the limbus. Having decided the line of sculpting, let's begin the nucleus management. The groove is made from just beyond the proximal rhexis and we stop just short of the distal rhexis. Ideally, one half the tip should be buried whilst creating the groove. Note that there should be no pushing of the nucleus while creating the groove. It's also important to note that the line of the groove and the Phaco probe need to be in the same line. With each progressive sculpt, there should be a progressive deepening of the groove thus created. At the end of sculpting of the groove, we need to get down to almost 95% of the depth of the nucleus. As you can see, we are now able to see some orange glow on the undersurface. Now, since the distal part of the groove is not that deep, the nucleus is rotated through 180 degrees, and now the distal part, which has now become the proximal part, is further deepened so as to achieve an equal deepening of the entire groove. Having completed that, the nucleus is now rotated through 180 degrees, and we are now ready to sculpt the groove at 90 degrees to the original groove in the inferior half of the nucleus. Prior to starting to make this groove, it's important to ascertain that the groove that you're going to create is going to be exactly at 90 degrees to the first groove. The challenge in making this groove is that you have limited space between the starting point of the groove and the inferior rhexis. We now rotate it around through 180 degrees to create the optimal deepening of this groove. Note at all times how the second instrument is held horizontally and holds the eye upwards to maintain an optimal positioning of the eye. Having completed the third groove, we now start to create the fourth groove. It is made in the similar manner as the previous one. Prior to cracking the nucleus into 4 fragments, it's important to ascertain that each of the 4 grooves are equally deep. It's important to get the perfect depth in all the 4 grooves prior to the nucleus disassembly. Let's watch now how we get to the optimal depth in all 4 grooves. You will now notice at the end of sculpting you've got an adequate deepening of all 4 grooves. The appearance of the orange glow signifies an optimal deepening of the grooves. Under viscoelastic cover, we now proceed with cracking the nucleus. The groove is rotated into an inferior position, and in a cross section with the help of 2 Sinskey hooks, notice how the fragments are broken down. Because there's a stirring up of nuclear material, either viscoelastic or a bimanual irrigation aspiration need to be used to clear out the cortex to regain the visibility prior to completing the cracking of the nucleus into 4 emulsifiable fragments. Whilst completing the breakdown of the fragments, some dispersed nuclear material is aspirated with the help of a bimanual irrigation aspiration. This is a very important step to ensure at all times that you have clear visibility of the nucleus. After introducing some more viscoelastic in the anterior chamber, I complete the breakdown of the nucleus into its 4 emulsifiable fragments. Having broken down the fragments, we are now ready to proceed with the fragment emulsification. The Phaco probe is introduced into the eye, followed by the second instrument, and watch how turn by turn each fragment is held in the aspiration mode of Phaco, then drawn out into the pupillary safe zone and then emulsified. Having completed the emulsification of 1 fragment, the nucleus is then rotated, the fragment now placed inferiorly is again drawn up in the aspiration mode and then downsized and emulsified. In this manner, the third and then the final fragments are also drawn up and emulsified. Whilst emulsifying the second last and the last fragment, utmost care should be taken to not accidentally damage the anterior capsule, either with the Phaco probe or the second instrument. We come to the end of the nucleus disassembly and emulsification. Following this, some more viscoelastic is introduced into the anterior chamber, after which we then proceed with performing the bimanual irrigation aspiration to remove the cortex circumferentially. The irrigation probe is used to maintain the anterior chamber and to stabilize the eye, whilst the aspiration cannula draws out the cortex and aspirates it. Having completed the removal of the cortex, the single-piece monofocal IOL is loaded, after which we now proceed with the IOL insertion. Counterpressure is often afforded with the help of a Sinskey hook head in the paracentesis incision, whilst the IOL is injected into the eye and then within the capsular bag, after which it is rotated to achieve a horizontal orientation of the haptics. This is followed by the visco wash, wherein the excessive viscoelastic is removed from behind the IOL by performing, as you can see, the rock and roll movement of the IOL, which gets all the viscoelastic from behind the IOL out in front, after which it is aspirated, and the viscoelastic is then finally removed from the anterior chamber. We now get to the last step of the surgery, which is the hydration of both the paracentesis incisions as well as the main incision. This, as you can see, now brings us to the end of the surgery. I do sincerely hope that you found this video tutorial useful, and this will enable you in getting started with the nucleus management for phaco emulsification. Thank you.